Jim, Ken talked me into something here. I've been a farmer, and I've been farming for a long time, all my life. And I had an accident about 25 years ago and lost my right hand. So I had to learn a lot of stuff over. I had to learn the right left hand, which doesn't go good. There's certain things you can do, but most stuff you can do. You can sip your sweaters and wear shirts that you don't have to button, that you can strip on, and you don't have to bother with that. And then I'll show you the prosthesis Ken made me, which he does a good job of. Yeah, put a plug in for you.
There you go. Thank you. Thank you.
This is prosthesis, and he just made this for me. I'm pretty rough on them, so I try them on. If they're no good, I come back and complain, which isn't very often.
This is our 2-week follow-up now, right? So you've had this for about 2 weeks.
2 weeks. I have
this
it
new
now,
one.
yes.
Yep.
But I was used to, and I knew how to handle them.
Yep.
You can pick up stuff by just opening up, and you can turn the hook for left or right. Sometimes you should tighten this up a little more, because when I go to left, then it spins back on me. You know what I mean?
Yep.
So just tie your shoe. You can tie your shoe. I hold that as long as they don't have the cat getting my strings. Cat comes in the morning to help put my shoes on. That's rough. And I can use a shovel snow, most anything.
So the terminal device that we have here, this is called the terminal device. Some people call it a hook. This is a special hook. It's a tool. It's called the farmer's hook, and he just happens to be a farmer, so
something like that.
I guess it's appropriate.
I guess.
But instead of just the straight hook that you see that would open and close, this has some kind of tool handles here. There's a place to hold a knife for cutting food. There's a small
nails you put in here.
A nail holder. We'll show you in a little bit. There's a place here for shovels or broom handles.
Fork handle.
There's a chisel. There is a place for a chisel holder here. There's a chisel holder.
But a square one works best.
The square chisel works best.
Yeah, the round ones don't fit into it, but you get a square one that fits in there.
Yeah. So this is a special terminal device for for more active people. Someone that's going to use the hook. The arm is held on by a figure 8 harness. You can turn around. So you can see it goes around like an 8. It's called a figure 8. This side is basically an anchor. Okay, so it anchors off the opposite arm, opposite shoulder. When he bridges his back and pulls his back wide, so the scapulars comes out, the hook will open. So that's how the terminal device and the cabling it's run off this side here. So it's off the anchor that when you bridge your shoulders, the terminal device will open. Okay, you can turn around. Pretty much
it.
Yeah, he's a long. He lost his hand, so he's got a long residual limb, or he's a long below elbow or long transradial amputee. So he's got a lot of leverage to work, and it's an advantage to him that he has that leverage. He does use this very, very hard, so he works well with the prosthesis.
Yeah, you don't need a hook for the hay. You just grab a hold of the strings.
Yeah.
Sometimes they don't let go on you. I did an accident with it that way.
Okay.
I was up in the hayloft, threw a bale on and caught the hook, and I went with down.
Oh boy. Look out.
I fractured hip a little bit, that's all.
Ouch. Oh man.
So you gotta watch it. Sometimes it don't release it on you. Watch what you do.
Yep. So,
live and learn. And
then sometimes he's got a sock here in his pocket. Sometimes as the swelling goes down, he'll wear a sock inside the prosthesis. So, if he needs to take up some room, he'll wear a special prosthetic cotton sock that he wears inside there.
When it gets too cold, I put an extra one on.
That's it.
Yeah, that's good.
So we're gonna take a break here. We'll go show you some of the things he can do with the hook. All right, Jim's gonna show us how to nail, how he uses the wood to nail into.
Yep, that's what happens.
No pressure, Jim. You passed that test. You got a longer one now?
Yep. start it and you're all right. Good thing about this, you miss, you don't hit your finger.
Oh, that's almost what I was thinking, Jim. Thank you very much.
That's the good part. You know?
That's the good part.
If you don't have a hammer, you go like that.
You don't have to worry about hitting your thumb. You don't have to worry about hitting your thumb, huh?
That's when I get into trouble.
Did you just use your prosthesis as a hammer too?
Yeah.
Oh.
When you don't have, you have to use
When you don't have a hammer, you
go like that.
Oh man. Oh, I missed it. Show me again. This is a sample of the chisel holder in the hand.
You can adjust it. You have to go that way.
So wherever he needs it.
The bottom.
Okay.
I think I'll have to go once around it. Well, you have more springs to put in here. You need to get all of the loose
So that's the chisel slot. Okay, Jim's going to show us how he picks up a trash can with the prosthesis. You're going to carry it around the shop. If he's got to empty it,
that way.
you could swing it.
Or you can empty it this way. I think it's got little nooks at the bottom.
I want to empty it in this here.
Either way you can empty it. It's got a little nook right there. That's what you need. And you empty it like that.
Excellent.
This is why I like to turn it. Carry that. Awe-inspiring.
It's pretty good, Jim. Pretty good. Very good. Okay, Jim's going to show us opening some of the dresser drawers.
Bottom. As low as you want.
That's it.
Pick your nose.
Oh, don't do that. We're going to demonstrate the knife holder. Go ahead.
Yep.
There's a small catch on there on the top.
And the top is nice, a little too broad. But sit in a little, not too bad. So you can cut it either way.
Okay.
You can turn it that way if you go this way.
So if you have to do any carving, you do that way.
I don't know about the small one.
Or try the butter one. Let's see.
That might be a little small. It hooks in. You can keep it in the back there. Yeah, it turns down on me now though. Gotta go with the top of that one.
Okay.
You have to go with the top. If you go with the bottom, it'll turn up on you. When you
Gotcha.
got it?
Got that. Now we have a couple tools to work with over here. You want to show us some of the tools? We don't have any hay bales for him to.
That we use like that. Left or right. And just right there. Main thing's got a lot of rubber on, so it don't open. Get the broom. It's not much different. When you're forking manure, you got to get down here more. You get better leverage. If you go up here, it's too heavy.
Okay.
Don't forget that spot over there.
You missed the spot, huh? He missed the spot, huh?
Should have turned down.
All right.
He missed it.
Anything else you want to show us or you can think of or talk about on here?
I don't know. Said we can tie your shoes.
You want to tie shoes?
As a snap-on today.
You got the Velcro.
Yeah.
Oh, that would have been impressive. All right, Jim's going to show us this sample of tying a shoe.
Are you ready?
We're ready. It's not a race.
Not a race. Boop. Hold it pretty tight. See, here's where my problem comes in. The cat always pulls it over on me.
All right.
That was pretty quick.
That's awesome.
Very good.
That was very good, Jim. Thank you. That's awesome.
So that's where my problem is. The cat goes like this when I'm tying shoes.
The cat keeps pulling the strings.
That's fancy.
All right, we got tape.
They told me I needed therapy. I said, I don't need therapy. I can pick this up myself, which I did.
You have to learn a lot of it on your own, right? Therapists don't even think about it. Go ahead, show me. Peel me
No, I don't wanna peel
peel
it.
me a piece. It's okay.
This is a new piece.
This
I
is the
don't
cheap tape. Might start a new roll here.
want- That's what it is, a new roll. I don't want to start.
You just clip your nails and
I don't have to clip them. They wear off.
all right.
Easy. You can see you can hold it. You roll it.
Excellent. Excellent. Very good. Thank you. We're just going to show the hook opening and closing again. It's the cable system. Go ahead, bridge your back. You see open. That cable pulls and shortens and opens again. And then on the wrist there, right in this area, point out the rubber bands for me. He's got multiple rubber bands right now. What do you have, about
4 or 5?
He's got 4 or 5 on there. The rubber bands on the terminal device determine the tension and how tight that hook will close. So it works with.
Pull your shoulder or fork, whatever you're using, goes in there.
Okay. So the tension is determined by how many rubber bands he has around the wrist.
It makes your arm stronger.
And he says it makes his arm stronger too. So
you use it for whatever.
that's the Solaflex before they had Solaflex. So. And the rubber bands, you want to pick up a rubber band, just show them what a rubber band looks like before it's stretched on there. Just show them that in your hand.
Show it in my hand.
Yeah, just to show them how the rubber bands look. Just special elastic rubber bands they'll get stretched over. So that's gives them the tension. So, all right, Jim. Well, thank you very much for helping out. Appreciate it.
Saving them kids, don't worry about it.
I appreciate it. Jim, I just wanted to ask you about, have you ever used a prosthetic hand, and what are the differences from a mechanical prosthetic hand versus the mechanical body-powered hook that you're using now?
It's hard to operate. This is a lot simpler and a lot tougher. Holds up better. I didn't use it long, so I didn't practice on it, so I wouldn't know.
Okay, so the hand was a little more.
Yeah, I didn't practice on it either.
Yeah, they tend to be a little more clumsy. These have a little more.
As you can see what you're doing, like you said, you can see what you're doing out there.
Yeah, the sight lines are a little better.
Yeah.
Okay. Well, thanks again, Jim, for your help.